So I guess finally to finish, because it wouldn't be a podcast in this day and age without talking about COVID. Um, I guess a few of you are obviously working at the moment during COVID in clinical settings, particularly. So I'll just ask a couple of you kind of around how has your approach to physical activity really changed in terms of where you're giving advice during COVID? So I'll go to Sarah first.
Thank you, Dane. It's a tricky one, isn't it, when you at the same time want to promote exercise and yet the government has said that people need to stay inside. And I'm just trying to have those conversations, especially with my frail elderly patients, saying that if you don't use your muscles, you will lose your ability. And actually, sitting down is not good for you. So whether you're walking around your house or walking around your garden, you can still make sure that you can increase your heart rate for your health. And that's a really important thing to do for mental health as well as physical health. So trying to have conversations to emphasize the importance of looking after their physical health actually helps to motivate them. And if they know that you're going to ask about it next time you speak to them, then they're more likely to actually follow through on your recommendations. So I think it's one of those things, everybody knows that the doctor's going to check your blood pressure when you go to see them. If everybody knows that the doctor's going to ask about your physical activity levels, whether that's a phone consultation or whether that's a physical consultation, they'll be more motivated to do things about their physical activity in the meantime.
Yeah, and you make a really good point there around some of the challenges we have around inactivity, particularly because people potentially are staying at home more. And again, the government and the CMOs have made it really clear that the advice is that physical activity is really good and you should do lots of it. But obviously there is elements around fear or worry or other reasons potentially why someone might stay at home more. So yeah, getting that message across as part of our kind of preventative medicine approach is really key. So Josh, I'll finish up and ask you the same question really around how you've been providing physical activity advice during this period.
Yeah, well, obviously doing our consultations remotely, I guess it has had its challenges, but I think the one of the interesting things that's happened is because people's routines have been disrupted and they've not been able to leave the house as much. It's also an opportunity to sort of try and build new habits into what their existing routine might have had as barriers. So, again, maybe some people had ideas that you could only exercise in a gym, but actually now helping people to think about home-based workouts, using minimal equipment as maybe something they can build into their day and into their routine when they are going to spend, maybe a lot more time inside. Also, again, because our structures have been taken away, in terms of, again, we might not have the same commute to work or the same kind of working hours, thinking about actually scheduling in exercise and really structuring it into the day. So not just the idea, I will exercise this week, but, is it going to be on a Wednesday at 4 p.m., doing this particular thing, and really try and get people to kind of have that routine kind of structured into their day and their routine. And again, I think it's actually, yes, it's some people it's helped them think more flexibly and it's helped them build habits in a way that's actually maybe there was barriers there before that can be overcome. So it's been an interesting one, but yeah, I think it's been helpful.
Yeah, it has been interesting, hasn't it? Because I think a lot of the kind of data that I've looked at, there's suggestions that potentially people with long-term conditions are potentially doing less at the moment due to a variety of reasons around risk and fear as well. But then there are a lot of people who are actually doing more because they've suddenly got more time on their hands as well. And actually it was one of the first things the CMO said you can go out and do more of. So I think it'll be really interesting for us to see what that data looks like when it comes out.